This video is for my nurses who are working right now on the floor. And I need to make a distinction between NCLEX world and real world nursing. And this is in regards to what you do as a nurse, okay? So for NCLEX, we are very strict about delegation. People who have the title of RN, PN, and unlicensed personnel do certain things, and those lines don't cross, okay? But for NCLEX, but for real world nurses, I just want to tell you guys, from my own personal experience, go in there, be prepared to do nurse's aide work, okay? In fact, I think you should make an expectation on yourself because, well, how do I want to say this? Okay, for me, I personally have found in my nursing career that yes, it is wonderful if I go to a facility and I have a nurse's aide who is on her job, who's doing their vital signs, who will do bath, who will make sure every time your patient has to go to the bathroom, they are there, fill up your patient's water, pitchers, whatever they need. And it is awesome. It is a wonderful relief. But I've also worked in facilities where nurses aide, they come in and they say, today I don't feel like doing no baths, and I'm not doing no baths. And I've had nurses aides who say, I'm just as busy as you, okay? So don't ask me to do no blood pressures. Don't ask me to do this. And because the culture at that hospital is such, it is okay for them to behave that way, and they don't get reprimanded. Yes, you could write them up, or you could, talk to them by the side and say, hey, I really need us to work together. Okay, and sometimes it works, sometimes it doesn't work, okay? So, me, myself, I have a great relationship usually with my nurses' aides because I don't mind doing things outside of my scope of practice. Particularly, I prefer it. When I have a set of 4 patients on a cardiac unit and I'm in their room doing assessments, guess what? I do their vital signs too, because I want to know right then and there, what is their blood pressure? What is their heart rate? I have to give a medication in 1 hour. So yes, I could have the nurse's aide do it and come back to me an hour later or 2 hours later, which I have had done, and say, oh yeah, I forgot to tell you, your patient's blood pressure is 80 over 40 or 200 over 125. Or I could have did it when I was in there, okay? And that, the nurses' aides usually typically appreciate that, okay? So I go in there, I take my own vital signs because for me, it's less stress. I know the condition of my patient right then and there. If I need to call a doctor, I'm not calling them at midnight. I can call them at 10, more reasonable. I know how my patient is before I leave. And it just makes my job a lot easier. So I'm encouraging you guys, don't be afraid to do those things. Don't think that you're above doing those things. The second thing is when you're in the patient's room and they have to go to the bathroom, or they need their water pitcher, or they want some ice cream, do it. Don't defer patient care, and say you're too busy. Write down your clipboard and say, hey, I'm going to take you to the bathroom right now, but give me 5 minutes and I need to go see my other patients, and then I'll bring your ice water back in. You don't necessarily have to go to your nurse's aide and say, hey, somebody in room 14 wants some ice water. Because, they do have things to do as well. So just be mindful, but I want you guys to be realistic that, yes, when you start your job as a nurse, you will be doing nurse's aide work. Guess what? You'll be doing dietary work. You'll be doing pharmacy work. You'll be doing housekeeping, okay? And that's where a lot of stress comes in for new nurses, because you find that even though you're the nurse, you are the patient's everything. You're the last line of defense. You protect them. You keep them clean. You keep them happy. You are the buffer between them and the politics of hospitals or home health or wherever you are. So take that information and be great nurses. Bye-bye.